Hi, hello, welcome back to Future Nurse YouTube channel. So please subscribe and support our YouTube channel. So let's start today's video. So the first question is, a nurse aide who is active in her church is assigned to care for a client who is not a member of any religious group. The nurse aide should. So options: help the client understand the nurse aide's faith, tell the client that it is important for the client to join some church even if it is not the nurse aid church, respect the client's beliefs and avoid starting religious discussions, arrange to have the nurse aide's clergyman visit the client. So option C is the right answer. So next, the nurse aide notices that the client mail has been delivered to the client's room. The nurse aide should open the mail and leave it on the client's table. Open the mail and read it to the client. Read the mail to make sure it doesn't contain upsetting news. Give the client the unopened mail and offer help as needed. Option D is the right option. So next, which of the following is the correct measurement of urinary output? So correct measurement for urinary output. Options: 40 OZ, 300 cc, 2 cups, 1 quart. So the correct answer is 300 cc. So next, the client offers a nurse aide a $20 bill as a thank you for all that the nurse aide has done. The nurse aide should take the money so as not to offend the client, politely refuse the money. So she has to refuse the money politely. Option B is the right answer. So next, all of the following situations are examples of abuse or neglect except. So options: restraining a client according to a physician's order, leaving a client alone in a bathtub, threatening to withhold a client's meals, leaving a client in a wet and soiled bed. So restraining the client according to physician's order is the right option. Option A. So next, if a client is sitting in a chair in his room masturbating, the nurse aide should report the incident to the other nurse aides, tell the client to stop, laugh and tell the client to go in the bathroom, leave the client alone and provide privacy. So option D, we have to provide privacy. So next, to convert 4 ounces of juice to milliliters, the nurse aide should multiply 4 into 5 ml, 4 into 10, 4 into 15, 4 cross 30 ml. So you need to multiply 4 into 30 ml. Option D. So next, in giving care according to the client's bill of rights, the nurse aide should. So options: provide privacy during the client's personal care, open the client's mail without permission. So the nurse aide has to give privacy during the personal care of the clients. Option A. So next, the last sense of dying client will lose in. So the last sense of a dying patient is smell, hearing, taste and sight. So option B is the correct answer, hearing. So next, a client wakes up during the night and asks for something to eat. The nurse aide should. Options: check client's diet before offering nourishment, tell the client nothing is available at night, explain that breakfast is coming in 3 hours, tell the client that eating is not allowed during the night. So she has to check the client's diet before offering any nourishments. So next, the normal aging process is best defined as the time when. Options: people become independent and childlike, Alzheimer's disease begins, normal body functions and senses decline, people are over 65 years of age. So the normal aging process is best defined as the time when normal body functions and senses declines. Option C. So next, if a client is confused, the nurse aide should. If the client is confused, ignore the client until he starts to make sense. restrain the client so that he does not hurt himself, keep the client away from other clients, help the client to recognize familiar things and people. So option D. So help the client to recognize familiar things and peoples. What is the process of restoring a disabled client to the highest level of functioning possible? So options: responsibility, retention, rehabilitation, reincarnation. So rehabilitation is the correct option. So next, when changing an unsterile dressing, the nurse aide should wash hands. When she has to wash hands before the procedure, after procedure, before and after procedure, before after removal of side dressing, and after the procedure. Option D. So next, clean bed linen placed in a client's room but not used should be: if the linen is not used, return to the linen closet used for a client in the next room, taken to the nurse in charge, put in a dirty linen container. If it is placed in a client's room but also not used, means it has to be put in a dirty linen container. So next, the nurse aide finds a conscious client lying on the bathroom floor. The first thing nurse aide should do is help the client into a sitting position, call for assistance from the nurse in charge, offer the client a drink of water, check for signs of injury. So she has to call for assistance from the nurse in charge. Option B. So next, if a nurse aide finds a client who is sad and crying, the nurse aide should, if the patient is sad and crying, means options: ask the client if something is wrong, tell the client to cheer up, tell the client to stop crying, call the client's family. So she has to ask the clients if something or anything is wrong. So next, clients have the right to options: smoke in any area of the facility, have access to a telephone, go anywhere in the facility, see other clients' medical reports. So the clients have rights to have access to a telephones. So next, proper use of a waist restraint requires that the nurse aide release the restraint every hour, watch for skin irritation, tie restraints to the side rail, apply the restraints tightly so the client cannot move. Answer is watch for skin irritations. Option B. So next and last question, to prevent the spread of infection, how should the nurse aide handle the soiled linens removed from a client's bed? Shake them in the air, place them in a neat pile of on the floor, carry them close to the nurse aide's body, put them in a dirty linen container. As I told previous question, put them to the dirty linen container is the correct answer. So friends, we have come to the end of the video. So please subscribe our Future Nurse YouTube channel for your upcoming AIIMS NORCET in 2024 and other competitive nursing officer examinations. Thank you.